Hello and welcome to our show today. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today I'm joined by two guests who are here to share a unique experience a woman can only find at Lourdes Hospital. It's the Nurse Patient Navigation Program, and I'm joined today by Courtney Laneeve and Amy Manley to discuss what this program entails and how women can benefit from it here locally. Welcome to the show today.
Thank you.
All right, if you would just kind of briefly tell us about yourself. We both, obviously, you're both nurses, but how did you decide to come into the nursing field and how long have you been at Lourdes?
I have been a nurse for 16 years, and I started out in intensive care, and then I moved to recovery room, and that's when last year about this time I found out about this job opening as a nurse navigator, and it was very intriguing, and I just thought it sounded like a wonderful way to connect with your patients, and so I applied, and Amy and I we job share.
Okay.
I work 3 days a week. She works 2. We both have small children. I have a 4-year-old little girl and a 6-year-old little boy. So we're still busy right now.
Yes.
Definitely.
I've also been a nurse for 16 years. I started in ER and then kind of worked my way to surgery. I saw the mastectomies to the biopsies and the simple breast surgeries, and I was also intrigued by this position. So we've both been there since May of last year. I also have two small children at home, so we stay busy all around.
Oh, so. Definitely. Well, that's great then, and y'all have a wide variety of experience that you obviously bring into this position too, and so you've seen different sides of what women can go through,
yes.
And so that's nice to be able to share that. Have you all had to have any special training to become a nurse navigator?
We did some training with a surgeon and a gynecologist to kind of see both sides, and I think this process changes so often that we continue our training, but
Right.
we are both working to be certified.
Okay, good. And what really appeals to you all about you know, you're in surgery, and that's definitely a different field, and then you hear about this nurse navigation job. What was so appealing to you all about that?
I loved the relationship you could build with your patient. Unfortunately, in intensive care, everyone is usually so sick that, you know, you do have a patient that'll stay for a while, but it's hard to find the time to really sit down and spend time with them. And when I heard about this, it was just the relationships that you build with these women, and you walk with them along their pathway through their cancer treatment, that's just nursing to me.
Mm-hmm.
That's what we're here for, and it was just something I just wanted to do.
Great. What about you, Amy?
I think I just saw the short part of treatment. You know, I saw ER, you don't follow them through the process. And again, with surgery, everybody's sleeping. This way, you get to meet everyone in the family, and you see the beginning and all the way through to, you know, survival and completion of treatment.
Right. You're able to talk to your patients.
Yes.
It's a good point. I never really thought about that. So what exactly do you do then as a nurse navigator at Lourdes? Someone hears the job nurse navigator and they're like, what is a nurse navigator? So
that's exactly what we said. We heard about what does a nurse navigator do? So basically, we establish a relationship with the patient, and we walk alongside of her through her whole cancer treatment process, and become friends with her. We help plug her into where she needs to be. You know, when you're diagnosed with cancer, you can hardly think of what's next, what's your next step. So we're there to kind of help them. They can utilize our services at any time. But we do breast health education, and we meet them when they come in for their mammograms.
Call the results of the mammograms to them within 24 hours.
that's good. So they don't have to wait.
You don't have to wait for you still get your letter, but you get it sooner also.
Okay, good. So it leaves women with less apprehension and
Exactly.
nervousness about what their future entails. So if there's something wrong, they'll know. If there's nothing wrong, then they don't have to worry about it anymore.
Yeah, generally we'll just say, you know, your mammogram was normal, so we go off of what the radiologist recommends.
Right.
And if they recommend they come back in 1 year, we just give them the recommendation. Or if the radiologist reads it as an abnormal mammogram, they put their recommendations on the report, and we share that with the patient, and we kind of explain to her and educate her why she needs to come back and the importance of it, and make sure she's, you know, knowledgeable to what's going on.
So whenever you make that call, if it was an abnormal mammogram and you say, you need to come back in, maybe she's a little scared when she goes back in, are you all available to her then? Do you kind of hold her hand and walk her through it? Okay, good. So they don't have to be
alone.
There. Yeah. Now, is there a cost associated if a woman gets put into the nurse navigation program and they may worry, what if my insurance doesn't cover it? Are there charges for your services?
No. And in fact, there's a program at the McCracken County Health Department, and I think there is maybe another local health department where women can go if they don't have the financial means to get a mammogram. A lot of women will not come because they can't afford to pay for it.
Right.
But it's the Kentucky
Women's Cancer Screening Program.
Ovarian cancer and breast cancer. And if they qualify for this, as far as what their income is, then they will give them a voucher to have a free mammogram, and then if it were to turn into cancer, Kentucky picks up the bill for their whole cancer treatment. So that is an option out there they should definitely look into.
Okay. So if a woman's kind of scared about that, they can talk to you and then you could refer them over to the health department for that initial.
Right.
And then they could come back and follow up. Okay. That's good to know. Women maybe are a little apprehensive sometimes about even just going to the health department, because obviously sometimes you think health department, you just think of like vaccines and that's about it, right? You take your kids there to get vaccines, but you are right that Kentucky Women's Cancer Screening Program is very beneficial, and there's been lots of women screened and diagnosed and treated through that program, and so definitely want women to know about that. Thank you all for sharing that. So let's talk about the different breast health services, because there's so many. A lot of people just think mammogram and that's it, but there's different types of mammograms too. I think most everybody here in our area now has digital mammography, but some people may not know what digital mammography is, and there may be some women that maybe had a mammogram years and years and years ago and it was film, and now we're talking about digital and they have no clue what the difference is. So can you all kind of explain that?
Well, it's higher quality. You're going to get a better picture in the end, so the radiologists can spot things easier. So you can still print out films that they can take to their physician. So
we actually got a new machine in September of 2011, and it's more user-friendly. It's just the images are just crystal clear, which is another reason why we sometimes have to call women back. The better the machinery that you're using, the more likely they're going to see more things, because and that's what we want. We want to be able to just look right through that breast if we can, and see if there's any abnormality. So so it's a good machine, but but you might get called back because we just want to make sure everything's okay.
But have you seen less callbacks for not good photos? Sometimes you'd go in and have with the film, you had to wait for the film to be developed, and then they call back and say, we didn't really get a good picture, you've got to come back in.
It's more of they didn't see it on 2 years ago's film, and maybe it's something normal, but it wasn't visualized then and we can see it now. So you might get called back for that, and it still ends up being something normal. We just couldn't see it before.
Great. So the digital mammography really lets the technician be able to see what's there on the screen, and they know that they've got a good picture, and so women are going to be called back less likely for a redo just because of poor quality.
Right.
It's because they found something that looks abnormal. And just because it looks abnormal doesn't mean that it is, right?
Definitely.
We want women to know that. Okay, let's talk about a few other things that some women may not know about. What is a breast ultrasound?
It's the same as if you're pregnant. I think most women are familiar with if you're pregnant, you have an ultrasound of your baby. It's the same thing. They use the same, maybe just a little smaller probe, and just look at the inside of your breast.
Okay. And what about the breast MRI? That's kind of new on the horizon, but there are several physicians in our area that really, really like it. And especially for those that have maybe had breast cancer before in the past, the MRI is really helpful for them.
Where that comes in handy too is when you are diagnosed with breast cancer, one of the next steps that most surgeons have you do is have an MRI. because they want, before they do to even talk about the options of surgery, maybe a lumpectomy versus a mastectomy, they want to get a picture of both breasts so they can see if there's anything else suspicious in there. Go ahead and biopsy that spot so that you can make a game plan based on that. And so they're very much used for that. And a lot of women, if they have high risk, like a lot of women in their family, maybe aunts, mother, grandmother, have had breast cancer in the past, their physician may choose to do an MRI every year, every other year, just as an added precaution to help them, screen for their breast cancer if they were to.
Right, because the MRI will find it as a much smaller size than even the mammogram, right?
And that's important to say too. A lot of people want to know why they can't have an ultrasound instead of a mammogram. Mammograms hurt, they say. Well, they shouldn't hurt.
Right.
They should never hurt.
Right.
And ultrasounds are good, but as of right now, mammograms are the only screening tool recognized by the American Cancer Society. And ultrasounds are a good backup. They're good, but for, to verify if something's really there. But if you just put a probe down on something, it's easy to get lost in all of the pictures in there and not know if it's for real or not. So it's just used as a backup tool as of right now.
Some things that are seen on mammogram are not seen on ultrasound also.
Okay.
That's right, yeah.
So what if they do find something in that's suspicious on either a mammogram, the ultrasound, or the MRI, and then a woman is called in for a biopsy? Can you all kind of explain what that process entails for a woman if she was to get that call? And
Well, there's two types of biopsies, and it depends on what it is. If it's seen on ultrasound, then it can be done as an ultrasound guided biopsy. If it's only seen on on mammogram, then it can only be done as a stereotactic.
Okay.
And they're pretty much the same procedure. It's just what is used to see the area. So as a stereotactic, you would be laying on your stomach and it would be guided by mammogram. On the ultrasound guided, you would be laying in a normal bed and it would be guided by ultrasound. But they get very accurate specimens, and it's a lot less recovery time and a smaller incision.
okay, perfect.
Women are very surprised with how minimal it is. You come in, you eat breakfast before you come have your biopsy done. You come in, it's very quick. The doctor numbs your skin, and that's really the only pain that they feel, the numbing for just a second, and then a little bit down deeper, and then after that they just feel a little pressure, but they're always like, wow, this was not as bad as I thought it was going to be.
Yeah.
And you leave with a steri strip instead of a large incision with
Very minimal.
sutures.
Okay, so they remain awake and
Yeah.
everything during that. They can talk to the doctor.
It's
ask questions.
amazing what they've done now. I mean, technology is great.
What about afterwards? Are there any soreness or anything like that?
They're usually, they need to rest for the entire day, and they need to not use that arm at all, just to prevent any bleeding underneath the skin. It's not dangerous, it's just uncomfortable if they get a big bruise there. But they go home, they rest, and we just tell them to get somebody to get them supper that evening for them not to worry about it, and they wear a binder, they sleep in it. The next morning they take it off, shower, and go about their normal business.
Okay.
Kind of resume, I mean, gradually resume. You wouldn't want to go out and, do a lot of jumping jacks and bouncy
Right.
things. But other
Right.
than
So
that,
I'm going
you
to
just-
start weightlifting the next
Exactly.
day.
No Zumba the next day. but-
Okay.
Yeah.
Okay. And then what if it were to be maybe a little bit more intensive, or the biopsy came back and, it was cancerous or precancerous? What about breast surgery? What does that entail for a lady? And you guys have to sit down and talk with them before, I'm sure.
Well, what generally happens is they have their biopsy done, and then they contact their physician's office either in a few days after the pathology report is finalized, or they go back in for an appointment to sit down and talk with their physician. And once they have the diagnosis, then that gives the physician the okay to proceed with plans. So like I said, they might choose to do an MRI next. Sometimes they do a PET scan to see if there's any other areas of cancer that may show up. And once they do that, then we now have started having women come in pre-op to do some physical therapy exercises, to see a physical therapist in our women's center.
Okay.
And they get some information about lymphedema at that point and what to watch for. Then they're set up for their surgery, and after that, it's just, they sit down with their surgeon and make up a treatment plan of what's going on.
And then during all this, they still are able to come back to you all to talk, and you're always there for them?
We try to see them the morning of their surgery, and if they are an inpatient, we do visit them while they're there, and that's the time that we can answer questions or just be there for support and pray with them.
Okay. Well, there might be some women out there that are thinking, wow, this program really sounds great, so they want to know how they could actually come and take part in some of the services that you provide. So what should they do to be able to come over there?
Come get a mammogram.
Yeah, all they have to do is just request to have it done at the Lourdes Women's Center in the Marshall Niemer Pavilion, which is the building attached to Lourdes Hospital.
The newest building.
Right. We're the only nurse navigators in this entire region as of right now, and that's exciting. Lourdes is, I just think what they're doing is wonderful. They just, it's all about the patient and caring in the ministry, and we just are excited to be a part of this new program, and so far the women love it. And so they just need to request to have it done there.
Okay, so just request their physician to order their next one over there.
Yeah.
Okay. We've talked about how you all are alleviating some of those fears for women, but when are they actually connected to you? Does every single woman that goes through there see you, or is it just a few?
We try to make our presence known when we're there. I mean, we, of course, help the mammography techs. We bring the patients back if we are not a busy day and just get to know them before. But if your physician has given us orders, then we call you the next day. We talk to you then. Of course, if it is abnormal, we do see a lot more of those patients. But we try to get out and talk to everybody.
Okay, great. And there's two of you, so that helps too. So if a woman is diagnosed with breast cancer, maybe she comes back up to you and she's a little bit overwhelmed and she doesn't really know what information she needs, where she should turn. What kind of resources are you all giving ladies that are diagnosed so that they kind of have a plan and resources to turn to?
We have several organizations, of course the American Cancer Society, but we do more of an what is your need basis. We discuss what they need, and then we go from there. So we don't everybody doesn't go to the same place.
We give out a goodie bag that was provided by the Kentucky Cancer Program, and it has the Lance Armstrong Journal and Where to Begin instructional cancer book. It's wonderful. It's free. The women love it. You can write down all your medications, all your contact numbers. There's pockets in there for them to put important papers in, and at that point, we also, give them information about community resources that we have available around
And if they
here.
need a wig or if they need a transportation, of course, that's all going to vary where they go.
Okay, great. So they're not just left to figure it all out themselves.
No.
You guys give them the guidance and directions for that. Well, let's talk about another unique program that you all offer there at Lourdes, and it's the Beads of Courage. And this has kind of become a big hit in our area. You all are the only ones doing it. So if you guys would just kind of explain a little bit about that.
Well, Amy and I have been trained as Beads of Courage ambassadors, and we're just very fortunate to be a part of this program. Beads of Courage was started by a pediatric nurse in Arizona, and she wanted to be able to give pediatric children that were going through illnesses something tangible to hold on to and acknowledge their courage. This has been around, it's in over 140 hospitals around the world, but up until this point it has just been done for children, other than a small island outside of Hawaii. Some adults participated in it. So last year we approached Beads of Courage and asked if we could do this for adult women, and they believed so strongly in the Nurse Navigator program, that how closely we worked with the patients, that they said, yeah, I think this, they altered their journal. Every woman is given a bead journal, and it's just a little way to keep track of everything you're going through during your treatment. And then they come in and see us. This is all free of charge. They make an appointment. We sit down with them. We set aside about an hour, and we talk about everything that they've been going through, and we acknowledge that. And so far, we have about 30 women enrolled. So they are the first 30 women in the entire world that are in this pilot program, and it's exciting.
I love seeing the patients. It's wonderful. You get to know them more by this program.
Right. And so each bead means something on the necklace,
yes.
right?
They start their necklace with their name, and then from that point on, we acknowledge everything. A blue bead is a doctor's visit. The glow-in-the-dark beads are their radiation visits.
That makes sense.
Black beads are their pokes or their IVs. And this little lady here is for when she loses her hair during chemo. And believe it or not, when a woman can laugh about picking out this bead and find some humor in such a hard time that she's going through, it's amazing the impact that these have on these women. They bring their grandchildren, they get to pick out beads for their grandmother, and everybody gets involved, and it's just such a neat program. And something I have found is that I think we both have with the visits that we have from these women is women are expected to be caregivers.
Right.
They have to, suck it up for everyone in the family. They don't want to tell their husband that they don't feel good that day, or their children, or their parents, so they hold all of that in. Well, when they come and see us, they can be real with us. They can tell us how they're feeling, and we can help them with medication challenges they may be having, or direct them to the right person that they need. And it's just, we really build a relationship with these ladies, and it's a friendship. Sometimes we laugh the whole hour, sometimes we cry, but we get to know each other, and it's just a friendship, and it's been
It's wonderful.
It is. It's been wonderful.
So do they get to keep the necklace in, and every time they come back, you just keep adding to it?
It starts with their name and a mammogram bead, of course, and your diagnosis bead, and then every time you have a new treatment, you get a new bead. So, and we love giving beads, so there's so many reasons to get beads.
And then the coveted Purple Heart would be completion of treatment.
Okay.
And a lot of these beads have been handmade by bead artists from around the world and donated.
Wow.
So it's just it's a really neat program.
And that's unique too, because no one's necklace is going to look the same.
No.
Exactly.
Because no one's going to go through the same steps at the same time.
Right.
With every diagnosis.
Some people say, well, I don't really want to think about what I'm going through. Well, it's proven though that if you acknowledge what you're going through, that it helps you heal. If you talk about it, if you just acknowledge it. And so we've had these ladies are pleasantly surprised. They're like, we didn't think we'd get into this bead thing, but I love coming now, and they're just so excited.
So do you think that this program makes an impact then on the effect of their recovery?
Yes.
Most definitely.
Definitely.
And do you see women wearing them? And
Yes. They wear them to their chemo treatments
what I was
or their radiation,
Yeah.
and they talk about them. They talk about them. And, they get to pick out these special beads called courage beads, and they get to put a name on that. What have you been going through for the last week or so that you've really had a tough time with? And we're going to pick out a special bead. And it might be something, going back to church for the first time. A lot of women say everybody looks at me to see what's different about me, and they don't look at my face anymore.
Right.
Or it might be my husband seeing me without hair for the first time. You just don't think about a lot of the challenges that women go through. So.
And I've had several women that wear them proudly, and they say that they encourage someone to get a mammogram because they ask about their beads.
That's a good.
I love that one.
Yeah, that's really good. You said something earlier whenever you're talking about like how women kind of take care of everybody else, everybody but themselves, or they don't want to tell someone if they don't feel well because they just want to keep going through the day and be strong for the family. I think that kind of starts just with the initial even of going to get a mammogram, because sometimes women will delay it just because, you've got to take kids here, you've got to do this for other family members, or you're taking care of parents, and so you just always put yourself last. And so I think that's a really good point to remind women that it's important to take care of ourselves, because we have to take care of everybody else too. And if we're not here, you may worry about who will take care of those that you do love. That's a very good point. So let's talk then real briefly about how people can learn more about your services and contact you if they have questions. Can you give them some contact information for us? Your phone number? Or?
We are located at the Marshall Niemer Pavilion on the second floor in the Women's Center.
Okay.
Our direct line is 270-538-4644. 5867 if they have a specific question for us. If they would like to just schedule their mammogram or ultrasound, it is 444-2175.
Okay,
And they can dial that number always and be transferred to us.
perfect.
We also have a Facebook page.
Yes,
Oh,
I forgot
okay.
to tell you, we have a Facebook page.
So
Just search Lourdes Women's Center.
Okay.
And become one of our friends or like our page, and you can keep up with all the special things that we have going on, fundraisers for Beads of Courage, or just new things going on with the Women's Center.
And you've been doing some fun women's nights.
Yes, Ladies Night Out.
Yeah,
Yep.
so those are always updated on that Facebook page then too. So women could come take advantage of that.
That's
and
right.
Get a sneak peek. Well, Courtney, what's the one thing that you want viewers to take away from today's show?
How important it is to get your mammogram every year. Don't be scared. We're all girls there working together, and we just want to make you feel comfortable. We want you just to come in and just feel relaxed and get your test done, get your results back, and just feel good about being there.
What about you, Amy? What do you want?
I want to remind women that just because they're in denial about things does not mean it goes away. That it is very important to do self-breast exams and your yearly mammograms.
That's great. Great advice from two wise nurses.
Thank you.
Well, I know that there's probably a lot of women out there that are excited about this program, maybe hadn't known that it existed in our area, and so hopefully some women will be able to take advantage of that, and you all can help alleviate some of their fears that they have about breast health, and be able to get their screenings up to date and know that you're there to walk them through this process. So thank you so much for joining me today.
Thank
I really
you.
appreciate it. And thank you for joining us today. And if you have any questions about today's program, feel free to call our office at 442-1310. Have a great day.